Hello and welcome to COVID-19 Science in 2 Minutes, where I answer your questions about this pandemic. Today's questions come from Jane, who asks, how do I know if I should be tested for COVID-19 and where do I go? For starters, we should talk about the test, what it is, and how it's performed. This is called an RT-PCR, or real-time reverse transcription polymerase chain reaction. This is a test that is done by looking for viral genomes, or the viral DNA, the genetic material of the virus, in the patient. Something like a nasal swab or a sputum sample, so spit essentially, is taken from the patient and sent to a lab where they will conduct this RT-PCR. The results can be received in hours to maybe a few days. The test itself is fairly quick. The problem is lab capacity. So right now, the number of labs in each state that are able to perform this test reliably and get accurate results is very limited. And so their capacity or their ability to process test results is what delays these sometimes several days. So if you have symptoms, then you should consider seeing your doctor or contacting your doctor. What you should look for is after a potential exposure, roughly 2 to 14 days with the average of about 5. After a point of exposure, you'll develop a fever, a cough, and you may have shortness of breath. And that's because the virus attacks cells in the nasal passages, in the respiratory, upper respiratory tract, and down in the lungs. And so this makes it difficult to breathe. I should say you should seek immediate medical attention if this difficulty breathing or shortness of breath is concerning. It's too hard to breathe. You have a persistent pain or pressure in your chest. You have new confusion or loss of consciousness and inability to be woken up, or bluish lips or face. These sort of things are extreme, and they definitely deserve to be taken to the emergency room. However, I should say, if you're concerned about COVID-19, you should call your doctor first. Don't go quick care right away. Don't go to the emergency room. We want to limit the number of people that may be exposed if you are, in fact, infected with COVID-19. If your symptoms are mild, give them a call first. Explain to them that you think you've been exposed. Explain to them you have mild symptoms. You have a slight fever, a cough, that sort of thing. And then they will determine the right course of action. You should also consider talking to your doctor early if you're one of the higher risks for serious illness. These are adults older than 60, people that have heart disease, diabetes, and lung disease, as even a mild case of COVID-19 will present much more severe and cause much more risk, or is much more cause for concern in those demographics. If the doctor feels that you are a potential candidate for testing, they'll determine that based on your symptoms. They'll take the right precautions to bring you in, and then they'll perform the test and ask you to likely isolate yourself even more so than you already should be doing. So again, please contact your doctor first if you have any concern. Try not to go to the ER and the quick care and that sort of thing, because you don't want to expose more people if you are in fact infected. So again, look for those symptoms and call your doctor. Hopefully that answers your question, and I'll be back again with another video soon. Thanks.